Okay, I think we're going to get started. Thank you, everybody, for being here. My name is Sharon Myers, and I'm working as a nurse here every Tuesday, and maybe some other days, depending on what's going on in Linda's life. And today we're going to talk about what do my symptoms mean. Linda asked me to talk about symptoms, and you know, symptoms can be confusing, just like putting the slides forward can be confusing. Is it this one? That didn't work. Oh, I pressed that. So symptoms can be confusing because just like I just got asked about, you know, ridges on nails. One symptom can mean so many different things. And Mary said it was okay if I started out the talking about her symptoms. I don't know if you were aware, Mary, last week, she had all sorts of symptoms. Were you guys aware of that last week with Mary? So Mary was having, you know, a little bit of trouble walking. She felt like she couldn't, you know, couldn't think clearly. She was feeling weak. Lots of symptoms, right? And couldn't figure out what was going on. And eventually it turned out they figured out she had a vitamin B12 deficiency. So, you know, symptoms when you know, having difficulty walking or feeling dizzy or feeling like you can't think clearly, that can mean so many different things, right? And I think the trouble is that myself and all of us, we tend to think as we get older, well, it's just because I'm getting older, you know, and we just kind of push our symptoms off to the side. So I think that's why Linda wanted me to talk today about symptoms. And I'm going to focus on cardiac symptoms. We're going to quickly go through some other stuff, but eventually we'll get to talking about chest pain and cardiac symptoms. So the first thing we're going to talk about is what can cause fatigue and weakness, because that's a very common symptom at any age. So, you know, of course, poor sleep. And sometimes if we haven't been sleeping well and we start to get really fatigued and wrung out, we think it's because we haven't slept well. But as you can see, there's all sorts of other reasons that you could feel fatigue and weakness. You could have overexerted yourself. Maybe you worked out here, then you went home and you had to clean your house because you had company coming and you changed all the beds and you vacuumed and blah, blah, blah. And I mean, definitely that can make you feel weak and just kind of wrung out. More common, and I've seen this in cardiac rehab and with the patients that I worked with over at the hospital. It's very common if you're feeling weak and fatigued and even, you know, dizzy, is that there's been a medication change. Sometimes you've accidentally doubled up on a medicine that can affect your blood pressure, and if your blood pressure is low, you just feel like, oh God, I can't do anything. Or maybe, you know, you missed a dose of something that helps with your blood pressure and helps with you feeling well. Or more commonly, you've been started on a new medication that one of the side effects is lower blood pressure or tiredness. Sometimes when you start on a new medicine, it takes a little while to adjust to it, but they may have to lower the dose, at least for a while, and gradually build up. So that's a very common one, and something that's pretty easily fixed. All of these chronic diseases cause fatigue and weakness. Heart problems, you know, having an arrhythmia, having a valve problem, having an enlarged heart, having had blockages in your coronary arteries. All those things cause weakness and fatigue. Lung disease, having any kind of problems in your lung, pulmonary emboli is a big one, but cancer, all sorts of lung problems, asthma, COPD, all those things cause you to feel weak and tired. Dementia, of course. Kidney disease, if your kidneys aren't working well, they can't process all your electrolytes and chemicals in your body, and those can build up and you can feel tired. Of course, cancer, and then chronic pain. Any kind of chronic pain, after a while, it just works on you, it just grates on you. And even though you're going through your day and getting through your life, having this chronic pain can just begin eventually to cause you to feel just tired all the time. And any kind of blood problems such as anemia, all sorts of other blood abnormalities. So it's always good, you know, to let your doctor know, even though you think, well, it's because of this. You know, like Mary thought that it was all sorts of little things, but she wasn't thinking originally that it was a B12, you know, a nutritional problem. So always, you know, bring it forward to your doctors because it is confusing and sometimes it's confusing to them too. So dietary, low protein, electrolytes, low B12, diabetes, having a low or a high blood sugar, and then of course, sleep apnea. If you have undiagnosed sleep apnea, you will wake up feeling tired. You will be tired for the majority of the day. Or if you have sleep apnea and you forget to use your machine or you don't like your machine, you know, it's going to make you feel more tired. And I'm sure there's things that aren't listed here, but it's a very common symptom. And as you can see, all different areas that need to be investigated if you're having fatigue and weakness. So don't just brush it off, talk to your healthcare provider about it. And so when should you see a healthcare provider for fatigue? When your fatigue is associated with other symptoms such as chest pain. So if you're having chest pain and you're having fatigue, if you're having fatigue and you're also short of breath, if you're having fatigue and you can feel your heart racing, those are signs that definitely need to be seen sooner than later. And there's something going on besides not getting enough sleep or something like that. The feeling that you might pass out. Once again, that's something that needs to be taken care of soon. If you feel like you're going to pass out, that's a time to call 911. If you sit down and that feeling doesn't go away, if you lie down and that feeling doesn't go away, that's the time to call 911. Severe.
Also actually passing out.
And well, you can't call 911 if you pass out. So try to call 911 before you pass out. Severe, anything up here that says severe means you should call 911 or get to the urgent care, have somebody drive you to urgent care immediately. Exception of that is chest pain, and we're going to talk more about that when I get to the end. So severe stomach, pelvic, or back pain. You know, you can be fatigued if you have blood loss. So if you have unusual bleeding, such as in your stools or in your urine, that's also another urgent matter. A severe headache, worsening ability to walk or stand. It's, you know, if you're having that kind of fatigue, that's another 911 call. And if it's getting worse or lasts longer than a week, you just have this generalized kind of fatigue, you're still able to walk, you're still able to do your activities of daily living, but it's just either getting worse or it's persisting, then you need to get in to see your healthcare provider. And the next one I'm going to talk about is shortness of breath. So what can cause shortness of breath? A good thing can cause shortness of breath, which is exerting yourself, exercising, doing an activity. You guys all have a little bit of shortness of breath in here when you're exercising. So that's a good one. Stress, you know, if you're going to give a talk somewhere and you're nervous about it, you can feel just a little bit short of breath. Excitement can cause you to shortness of breath. That's another good one. And then of course, you know, cardiac comes up again. If you're having a heart attack, if you're having a partial, sometimes if it's just a partial blockage in your coronary arteries, having a fast rhythm or a very slow rhythm or valve problems, all those things can cause you to feel shortness of breath. Shortness of breath, you know, usually goes along with something else. Having a lung issue such as bronchitis, asthma, COPD, emphysema. Anemia, low blood counts, your hemoglobin hematocrit is low, so your ability to carry oxygen. Those are the things that help you carry hemoglobin. Is what helps you carry oxygen in your blood. So if you don't have enough hemoglobin, because you've been on a plant-based diet, it's a little bit harder to keep your blood count. It's 100% doable, but you have to be aware and do the right things. But you can have anemia, and so then you're not able to carry oxygen as well, and that can make you feel short of breath. If you're having an allergic reaction, seasonal allergies, of course, you get short of breath, an allergic reaction to medication, food, or an insect sting. So all sorts of reasons you can be short of breath. When to see a healthcare provider for shortness of breath. Severe shortness of breath that comes on suddenly and affects your ability to function. Anytime something like that comes on suddenly, that's a red flag. And, you know, if you're, well, I'll talk about it down here. So something comes on suddenly, should alert you and your family that something acute is going on here that I need to take care of. Any shortness of breath that's accompanied by a high fever, chills, or cough. If your oxygen saturation, we have the ability to check our oxygen saturation at home. Do any of you guys have the little finger thing at home? Yeah. So if it's less than 92, that's a sign that you need to go be seen, call 911 because something more severe is going on. Seek emergency medical care. Get medical care if your shortness of breath is accompanied by chest pain, fainting, nausea, bluish tinge to your lips, nails, or if you have a change in your mental alertness, or if somebody around you is having shortness of breath and you notice that they're confused, that's a time to call 911. And call 911 if your oxygen saturation is 88% or less. If you're symptomatic, yes, because those machines are not always accurate. So if you're, running around the house, dancing around the house, and you're trying to check your oxygen saturation and it's, 88%, don't call 911 because, and if you don't, your skin color looks good, you're feeling good, you're not short of breath, you're not dizzy, you're not lightheaded, you're not having chest pain. Yeah, just recheck your machine. Yeah. Back pain, that's also a common thing that we all get at one time or another. So what can cause back pain? Once again, right off the bat, all these things can be associated with heart issues, right? So symptom of having a heart attack or having a blockage can be back pain. And we're going to talk about the different places that can occur when we get to cardiac stuff. What other things can cause back pain? What other things have you had that caused back pain? Yeah.
Protruding disc.
Yeah, protruding disc in your back.
3, 4, and 5.
Yeah. L3, 4, and 5. Yeah. Same with you?
Yep, L5.
Yeah, L5. Yeah.
I'd say we have a lot of herniated discs.
Yeah. It's common as we get older, the disc space narrows, right? From osteoarthritis, and then there's no place for that disc to go. It gets smushed out. So a lot of us have protruding discs. I have some protruding discs also. So, but sometimes, they get inflamed and then it's pressing on a nerve, and that's what causes the pain. So that's the most common cause of back pain. Another common cause of back pain is that you've just tweaked a ligament or an attachment. There's a bunch of muscles running all over your back and they all attach using ligaments and tendons, and those can get pulled and inflamed. You can pull a muscle in your back. You could also bruise a rib by bumping into something, banging into a wall, those sorts of things. So some sort of musculoskeletal problem. That's the most common cause. Falling out of a tree. Yeah. Stupidity is a reason to have back pain, right? Did you hear what I said, Nick? So stupidity is what can cause back pain.
Yes. 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 My wife said, "Don't get up in that tree."
Yeah.
Well, that makes it worse. Yeah, I knew 2 people who pulled something cough.
Oh, right. That's a good point. Yes. If you have a really bad cough that's going on,
Oh, yeah.
oh my gosh, you can break a rib by coughing. So yes, or definitely inflame those intercostal muscles. They get all inflamed, and that's then the ribs are in the front and the back, so you can have pain there. Having a urinary tract infection or some sort of bladder infection can cause back pain. It's kind of in the flank area, lower back area. Having a kidney stone, same area, or having a pulmonary emboli. And that's when a little clot travels into your lungs and gets stuck there, and it causes acute shortness of breath, sudden shortness of breath and pain in this area here on either side, usually. So when to see a healthcare provider for back pain? If your back pain persists for 2 or more weeks, if the pain limits this is when you should just go see like a primary care doctor type thing. If your pain limits your ability to walk, stand, or care for yourself, loss of sensation or decrease in ability to use your arms or legs. If you have, numbness and tingling is what I'm talking about. Numbness and tingling, they just feel like, you just can't quite get that shoulder up like you used to. Those kinds of things. If your pain is severe, once again, call 911. get in to see somebody, because severe pain in your back could be a pulmonary emboli, you know, it could be something like that. Go to the ER if you have back pain associated with fever, chest pain, or shortness of breath. Go to the ER if you have a loss of ability to control your bowel or bladder function, because what's happening there is some of the nerves could be being compressed, and so your bowel and your bladder are not able to work well. So that's not something you want to let that persist. You want to get that taken care of. Sudden onset of back pain that occurs after trauma, such as a fall out of a tree or something, or a car accident. You want to get that taken a look at to see get x-rays and see what's going on.
Sometimes a car accident, it takes a couple days. But some of them still.
Yes, that's true.
Might wake up with it, but it's 2 days ago.
Right, that's the good thing, good thought there. So yeah, so get that checked out. Because you could have a fracture and you don't know.
You know, brushing your teeth. One time I was brushing my teeth
Yeah,
and I had back pain, really. Couldn't get it.
wow. You know, did you brush your teeth right after you got out of bed in the morning?
Yeah,
Sometimes, yeah, we're not quite, we're not quite moving very well yet. We can tweak all sorts of things. Linda's got a tweaky elbow right now. We don't really know what's causing that.
It'll be twice.
No, it's right here.
Oh,
It's moving around.
I have to switch arms every once in a while.
you could-
these
Wait.
ones, unscrew this one and put it down. Unscrew that one. Screw them back in.
So I want to talk about chest pain, because in all the previous ones that I talked about, shortness of breath and fatigue and what was the other one I talked about? Back pain. All of those, if you noticed on the causes of those, all of those could have been a cardiac problem, right? So it can be very confusing. So I want to spend the majority of time just talking about chest pain or cardiac pain in general. So in general, though, if you just have chest pain, if you're having pain in your chest, that could be for all sorts of reasons. It could be, once again, that you've pulled an intercostal muscle, you've, strained something here. It could be a musculoskeletal problem. You could have a problem in your shoulder that radiates into your chest. So that's actually one of the most common problems. And if it's a musculoskeletal problem, usually if you press on the area, if you move the arm and it makes it worse, it's a sign that it's a musculoskeletal problem. Cardiac chest pain does not get worse if you press on the little intercostal muscles or, move your shoulder a little bit. So that's a sign of a musculoskeletal problem. It can also be gastrointestinal, gastric esophageal reflux disease from eating spicy foods or citrusy foods, or just because we've developed it over the years and we have some reflux or gastritis and inflammation in the stomach. There's nerves connected to our stomach and our esophagus, and all those things can radiate and go up into our chest, and it can feel like we're having chest pain. Of course, it can be cardiac. It can mean that we're having angina, which is a lack of blood flow to the heart because the coronary arteries are blocked. And if if the blockage becomes too great, then of course you can have a heart attack. And we're going to talk more about that. It could be you can have chest pain just because you're having a really fast heart rhythm. So if you've got like a supraventricular tachycardia where your heart's it's beating in a regular manner, but it's just going really fast. Even in young people, that can cause some chest pain just because your oxygen consumption of your heart is so great with that fast rhythm. Or things like atrial fibrillation if it's going fast. Also, if your heart's going really slow and you're not getting enough blood pumped out, like a severe bradycardia can cause chest pain. And valve problems. Once again, a pulmonary embolism where you've got a blood clot that's lodged in your lungs. Typical pain is right here, but you can also have pain anywhere your lungs are. So you can have pain up here from a pulmonary emboli. And then respiratory things like pneumonia. It's very common when you have pneumonia or bronchitis to have chest pain. If you've been coughing a lot, you could kind of pull and strain the muscles in there. That can cause chest pain. So having COVID, a flu, a virus, asthma, emphysema, all sorts of respiratory problems. And then gallbladder problems. Once again, the gallbladder is, situated right here, but there are nerves that run up here. So sometimes gallbladder problems present themselves as chest pain. So people go to the ER and it's really a gallbladder problem. And then anxiety. Anxiety can cause us to have chest pain. Yes,
Esophageal spasms.
yes,
I
uh-huh.
thought I was having. a
Yeah,
heart
because
attack.
that runs right down right through here.
Yeah.
Yes, uh-huh, yep. Yeah, there's probably anything else that's not up here.
Pericarditis.
Oh, and the inflammation of the sac around your heart. Yes, can cause chest pain. So that's falls under the cardiac area there. Yeah. Anything else anybody can think of that's not up there that could cause chest pain? Okay. All right, so we're going to talk a little bit. So you can see, all the different places that I talked about, and all those things have nerves that are running up toward the chest. So you get referred pain. So I want to talk a little bit about chest pain from coronary artery disease. So you guys are well educated, I know, but so the coronary arteries are the arteries that run kind of on the outside, and they have little branches that go into the muscle, and their sole job is to bring blood and oxygen to the heart muscle. And that one right there is the left anterior descending. It goes right down the front of the heart. And this picture doesn't show it, it does show it. And then there's one kind of right over here. Here, there's one here. That's probably the right coronary artery. And but there's arteries, coronary arteries that go all over the heart, and their job is to bring blood and oxygen. And so the little breakout depiction shows what happens when we get plaque in there. So we can be developing plaque for a number of years, and it's just kind of like a little small layer, and blood can easily go by it, and it's not inflamed. And, we can do that for years. And then the problem is, at some point, the plaque gets bigger and bigger and bigger. We start to get worried about plaque if they do a heart cath and it's greater than 40% blockage, because that plaque is considered to be a little unstable, and it can rupture. And when it ruptures, it opens up, and the material inside that plaque is kind of blocking off that coronary artery. The coronary arteries aren't that big. And so that blocks it off. And then your body tries to help, and it sends blood clots there, just like when you cut yourself, your clots. Same thing happens inside your coronary arteries. So then there's these platelets that go there to try to help get that to stop bleeding, and they just completely occlude the vessel. And that's when you're in trouble, is because if that vessel is completely occluded, what does that mean? This whole area here for this, if the LAD has a clot right there and completely occludes the vessel, all down here, this whole part of that heart is not getting blood and oxygen, right? What happens if we don't get blood and oxygen to a part of our heart muscle for a while? It dies. Yeah. And it doesn't come back. You just develop scar tissue there, and scar tissue doesn't pump, doesn't contract well, it doesn't relax well, it doesn't work. It just gets dragged along with the rest of the healthy muscles. So it's not helpful once it's scar tissue. So when I'm talking about cardiac chest pain, we're really talking about angina or angina. But angina is chest pain or discomfort caused when your heart muscle doesn't get enough oxygen-rich blood. So it's like a cramping of the heart muscle. What happens if you put a rubber band around? If I put a rubber band around my arm, first it wouldn't feel so bad, but after a while, the muscles start cramping because they're not getting blood and oxygen. Same thing happens in your heart muscle. If there's an occlusion there, then that muscle that's not getting blood and oxygen, it starts cramping, and you get the chest pain, also called angina. So angina is not really a disease. It's a symptom of an underlying heart problem, usually coronary artery disease or blockages in those coronary arteries. Angina happens when one or more of the coronary arteries is narrowed or blocked. It can also be called ischemia, which is just a lack of blood flow to that heart muscle. So there's different types of angina, and it's kind of important to distinguish between them because some of them are more dangerous or urgent than others. So there's stable angina, which means that you have blockages in your coronary arteries. And so most of the time, say it's like a 40% blockage. Most of the time, if you have a 40% blockage, there's 60% left, right, for blood to get by that blockage. And most of the time, that's sufficient amount can get by, right? If you're just sitting in a chair, or if you're here on the bike, but you're not working all that hard. And so enough blood can get by to supply that heart muscle. But when we start working harder, say, you know, we go home and we decide we're going to dig up our tree in the backyard, and we are really working, you know, and your heart's really pumping, the oxygen requirement of the heart goes up. The heart needs more blood in order to pump that fast and work that hard. But the blood can't get by now because it's blocked off by 40%. So there's insufficient amount of blood getting to the heart when you're working harder. Or say your heart also works harder if you get in a stressful situation. All of a sudden you got epinephrine surging in your body, your heart's beating faster, the epinephrine makes it beat really strong. And so once again, your heart's beating strong, it's beating fast, it needs more blood and oxygen, it can't get it because of the blockage. So stable angina is when the blockage isn't big enough. And pretty much most of the time, blood gets by, even if you're in a stressful situation. Unstable angina is when that plaque that you have there is breaks open and you get blockage there, and you're in pretty bad trouble there because blood just can't get by and your heart's really needing blood and oxygen. When you have stable angina, it's the type of thing where, you know, blood gets by, and if you have some angina or something, you sit down, you relieve, the heart doesn't need as much blood and oxygen, the chest pain goes away. But if you have unstable angina, it's an indication that you've had some sort of rupture or acute event. There's platelets there, there's blood clots, because when you sit down, the pain doesn't go away. And as a matter of fact, you know, it can get worse.
It reminded me of Dr. K's slide, I don't know if you remember it, where you had a scale of balance. And there was a bunny on one side. And if you're in this resting state, it was two bunnies, because the money in he's keeping up with the bunny. But if you become unstable, then the second scale turns into an elephant. So it tips the scales a lot because the elephant's a lot heavier.
A lot heavier, yeah. Right. Yeah. So if you have stable angina, that means that your body is in pretty good balance, you know, enough most of the time, except if you're doing severe exercise or something like that, enough blood's able to get by. Yeah.
How does digitalis under the tongue help with a person that's having a angina attack?
You mean nitroglycerin?
You just need that.
Yeah, I just knew it.
Digitalis is an old cardiac med, but it doesn't
Well,
help.
that's how
in an-
long ago this goes back to.
It
So
doesn't, they don't usually use it in an acute situation for chest pain. It's
it is the
nitroglycerin that they
same as
use.
the
It's different.
Okay,
Digitalis just makes your heart beat stronger. They wouldn't really use it, I don't think.
my father had that problem, and I remember that's what he took, was the little digitalis.
Oh, really?
tablet.
Maybe that's an old treatment.
Did it help?
I don't know. I mean, he became, you know, I think so, was supposed to take it if he had a problem. And I know he did a couple of times, but he
Mm.
was, mostly his problem was lack of blood flow.
Yeah.
Which is what the nitroglycerin does.
Yeah.
It's a fast-acting vasodilator.
It's the same, yeah,
It's not the same thing, but
it's not.
it's probably an old treatment that they don't do anymore. Yeah, but now they use nitroglycerin. So yeah, so if you've got, you know, a blockage there, and say you just have a partial blockage, and you go out and try to dig up your tree and you get chest pain, and then you go in and you take a nitroglycerin and it dilates the vessel so more blood can get by. So that's why nitroglycerin works so
Okay,
well.
that's right.
Mhm. But if you're in having unstable angina, where there's a total blockage, you've got blood clots there, you've got platelets, you can try to dilate that, but it's not going to do much at that point. So there's a big difference between having stable and unstable angina. And I just remember that I have slides for each of these, so I'm going to go through them. So we get to review now. So stable angina, it's also called effort angina, right? Because it usually comes on when you're making a bigger effort than you usually do, working harder under a great amount of stress. It's usually precipitated by activity or stress, I will say. You usually don't have any symptoms at rest. Why don't you have symptoms at rest with stable angina?
You know, it's under the law.
You what?
Not under any load.
Well, the load's less, right? And enough, and so then therefore enough blood can get through to bring your heart blood and oxygen, right? At rest. But at exercise, when you're doing heavy exercise, your heart needs more. The demand is greater and not enough blood can get through to help that demand.
Every year, the Reno TV stations, right around the first snow, run reports about people, warning people about getting a heart attack shoveling snow.
Yes, that's exactly it. Yeah, that's exactly right.
But I mean, it never fails. We run it.
Excuse me, Sharon.
Yes.
I can't hear some of the comments.
Oh,
Yes.
we were talking about the higher effort and how that can cause angina. And someone was mentioning that shoveling snow, there's always a warning every year about not shoveling, go out and shoveling snow. Because actually they've done studies on that. Linda and I used to know the answer to this, but the Met equivalent for that, for shoveling snow is very high. You're really exerting yourself to shovel snow and a lot of isometric activity too.
Plus it's cold.
Okay, thank you.
And the coldness, yeah. Thank you for the reminder. So that's stable angina. Unstable angina, also called crescendo angina, because you can see there's like total occlusion of that vessel. So the chest pain will get worse because blood's just not going to get through there. It doesn't have a specific pattern. It could occur at rest, right? Because if you suddenly get a rupture there and you get platelets and blood, you could be sitting at rest and have that happen. Severe and acute, which means sudden onset, so it'll just come on. It's a dangerous type of angina that puts you at high risk for having a heart attack. So you don't want to dilly-dally with this one. No dilly-dallying. And then there's another type of angina called Prinzmetal or variant angina. It's a variant of the type of chest pains we've been talking about. Usually if you have this type of angina and they brought you in and they did a heart catheterization, they would see on your heart catheterization that you really don't have much plaque on the inside lining of your arteries. You might have a little bit, you might have some, but certainly not, the kind that you see kind of poking out there, not like a 40% blockage. And they believe that it's probably caused by spasm of the coronary arteries. So, what causes spasm of the coronary arteries? Some people just can get this genetically, but more commonly, anything that's irritable to the coronary artery is going to be more likely to have you have spasms. So things like a high-fat diet, having high cholesterol, anything that's going to inflame the inside lining of an artery is going to put you at greater risk for having spasms of the coronary artery. So if you were diagnosed with this type of angina, they can put you on medicine for this. It will help with the spasming, but also you want to be careful. Just because you don't have big blockages doesn't mean, oh, I don't have to follow a plant-based diet, because anything that you can do to lower that inflammation, the plant-based diet, the, red and purple and blue, fruits and vegetables, all those things, the anti-inflammatory qualities of plant-based diet will help this type of angina. And then there's another one called microvascular dysfunction. We're hearing more and more about this one, but once again, when you look at the coronary arteries on a heart cath, they'll look pretty clean. But what is happening is that further down the road, so the coronary artery, it sits on the heart. It's like, you can kind of see mine here. This would be like a coronary artery. If this was my heart, can you see on that? So, but what you can't see is there's those little branches that come off of them that go deep into the heart or go deep into the muscle. And that's called, just a microvascular part of an artery. And so those tiny little, and they're the ones that really perfuse. So those are the ones that can get some blockages in them. It's called microvascular disease. So those little small vessels that go deep into the heart, and there's a lot of them, are the ones that can get blockages and have dysfunction. There's no blockages that are significant in the large coronary arteries. But just imagine, I mean, there's a lot of them, they go all over, so you can get one little spot that's got some blockages or dysfunction, and then you can have some angina from that. They go to small places, so it's not as concerning, because it's not like if your right coronary artery gets completely blocked off, there's a big part of your heart that's not going to get help. But if it's just these small little microvascular arteries, they just go to small little areas, so it's not as dangerous.
Are those the same? Excuse me, are those the that go to your retina?
Yes, yes, there's, you can have, I'm talking about in the cardiac anatomy, but yes, you have these small microvascular vessels all over your body. And this is important. We used to think, when I first started hearing about this, we don't need to worry about this. And the other thing is this occurs more commonly in women for some reason. And so it was dismissed off the bat. It was like, oh, it's happening in women. Let's not worry about that. But no, it was dismissed because it was thought that it really was insignificant. But now we found that microvascular dysfunction may be one of the earliest signs of heart disease, and it may lead to plaque in the artery. So it's just a sign that you are laying down plaque. And if you're getting microvascular angina, you need to, really be concerned and get on the right medicines, get on the plant-based diet, do your exercise so that you don't get plaque in your big coronary arteries.
What would be the medicines?
Well, we'll put you on things, like cholesterol medicines, and the same things that they would do if you had blockages in your coronary arteries. So probably I'd say just Lipitor. I mean, this is not one of the ones that, like the other one, it's the previous one, the Prince metal one, where you're getting spasms. They put you on calcium channel blockers, sometimes beta blockers for that. But this is more worrying about dealing with the plaque that you're getting in the little vessels. So when I keep talking about angina, and these are all the different places that you can have cardiac, any kind of chest pain, but I'm talking about cardiac right now. So these are all the places that you could have cardiac angina. So the most common thing that we all hear about is like an elephant standing on our chest, right? And so we all think about that. We all know that one. So on our chest, kind of all the way up our sternum into our throat. So how many of you heard about having throat pain being associated with angina? Have you all heard about that, or is this new information? New, huh? Okay. Shoulder, you can see the third little representation there. He's got it in his chest and also in his left shoulder. And then in your kind of epigastric area right here. Sometimes, on both sides like this. So I make the mistake still when I talk to patients that are not feeling well and are fatigued, maybe a little short of breath. I'll say, are you having any chest pain? And they'll say no. And I forget to ask, are you having any pain in your throat, in your jaw, in your arm, in your epigastric area? Because those are common places. So I myself and all of us have to remember that angina can be, any of those places. And also in the back, which is the last little picture there. The two typical kinds of chest pain are mid-sternum heaviness, like an elephant standing on your chest, and then also on the left side of the chest, into the left shoulder and down the arm. More common in women for having symptoms of more in the jaw, the throat, or feeling fatigued or having shortness of breath, and maybe not having any of the chest pain at all. So that reminds me to tell you that you can be having angina and be having a problem with a blockage in your coronary artery and not actually have any chest pain. You could just have shortness of breath. You could just have severe fatigue, sweating. So if it's severe and it's something unusual for you, don't waste your time. So that's what we're talking about now. So call 911. Why? 40% of the over 1 million heart attacks that occur annually are fatal. So, if a big part of your heart doesn't get blood for a period of time, then it dies. And so those can be fatal. Many more patients who survive their heart attacks do so with chronically damaged hearts. So even if you survive it, you've got scar tissue in that area that doesn't work well. And it's hard to evaluate your own angina, right? You've got to go, and a doctor just looking at you can't evaluate it either. You have to get tests done and procedures done in order to really see what's going on. These are some of the tests that when you get to the ER that they will look at. The first thing they'll do is draw your blood, because if you're having a heart attack, there's something called troponin that's released from the cardiac muscle. It's called MB, I think MB troponin. And it goes in your blood, and it's a sign that there's your heart muscles releasing chemicals, and it's because it's under stress. They'll also do ECG or an EKG when you arrive, because on the EKG, you can see if the ST part of the PQRST is elevated or depressed. That's an indication that something's going on with the heart muscle. Echocardiogram, if they do a blood test and they do the EKG, and those two things indicate you've got elevated cardiac enzymes, your EKG shows changes, they'll take you directly to the cath lab. They're not going to mess around with this other stuff. And they try, time is of the essence. So they try, all hospitals, all emergency rooms, try to get you from the door of the emergency room into the cath lab with your cath going on within 90 minutes or less, because time is important. So these are some other, if you're having stable angina and your doctor wants you to go get some testing done, I didn't put on here exercise treadmill test. So exercise treadmill test, one of the first things they'll do if you go to the doctor and you're complaining about having throat pain or chest pain or back pain or fatigue or shortness of breath or diaphoresis, they'll do an exercise treadmill test first to see if under stress of exercise, there's a change in your EKG. So you'll be connected up to EKG while you're doing your exercise. But they'll do other things like CT scans, MRIs, and PET scans to evaluate your heart. But in an acute situation where you're coming into the ER, they're going to do a blood test and EKG and take you to the cath lab.
Sharon,
Yes.
I just heard you refer to that as an EKG, and that has confused me because it's looks like it's ECG, but I hear it constantly referred to as
Yeah.
EKG. So what?
Yeah, it's called, yeah, it's a good question. Sorry. Yeah, it's called both. Actually, the real term is an ECG because it's electrocardiogram with a C. I think maybe cardia in Latin is it's a German thing. Is that what this says? I'm going to read something here that Ivan just handed to me. EKG is an abbreviation for the German spelling of electrocardiogram. And so in German, it's spelled ELEKTROKAARDIOGRAMM.
Thank you. I have
Kind of guessed at it. We got it right. But thank you.
Yeah. And what do you know what it's called when you do a similar thing on the brain?
On the what?
On someone's brain when they do an
Oh, an EEG.
All right. Okay. Thanks.
Yes. So when to call 911 in regard to angina? Trust your gut. I think we kind of all have this feeling of this is something different. This is not right. And err on the side of caution. Chest pain that lasts for 5 minutes or more or comes back. So chest pain not relieved. If you have nitroglycerin and you get chest pain, I keep saying chest pain, but you know that when I say chest pain, I want you to think of throat pain, epigastric pain, arm pain, back pain that feels it's acute and it feels like something you don't normally have. If you take a nitroglycerin, you can take nitroglycerin under your tongue every 5 minutes for 3 doses, but you don't want to wait till you get to 15 minutes out. Take the first dose of nitroglycerin. If it doesn't relieve the pain that you're having, call 911, and until they get there, continue to do the next dose of nitroglycerin, but don't wait. People make the mistake of waiting. That's a whole 15 minutes that you're waiting before you even call an ambulance. And then it takes, 10 minutes or so for the ambulance to get there. Your time, you're getting pretty far out. So if you're having severe shortness of breath, It just comes on. I mean, something's going on. It's either a pulmonary emboli or it's cardiac, it's something like that. And especially if you have a combination of symptoms, which is typical, where you're having some sort of pain in all the areas I described, you're also having nausea, you're having shortness of breath, weakness, and you're sweating. So that's when to call 911. Do not phone a friend first to get their opinion. Or call the Sac State Cardio Wellness Program and leave a message for Linda. Don't do that. Do not drive yourself to the ER. Why shouldn't you drive yourself to the ER?
Cause it can,
You pass out
you can
Right.
die on the way to the hospital.
and kill somebody else on the way. Yourself and others, right? Also, you're delaying getting help. The people that come here in the ambulance, they've got everything they need to get you started on the correct treatment.
Mm.
Otherwise, you're delaying 15 minutes before you're even getting treatment. And with all the construction, you're probably delaying a half an hour before you're getting any treatment, even if you make it to the ER. So do not phone a friend or call the cardiovascular wellness program or drive yourself to the ER. 911 is the fastest way to get immediate care. That's what they're there for. That's what they're especially trained in cardiac stuff. Also, if you have a complete blockage, your heart gets really irritable. It's not getting blood and oxygen. It starts like beating funny. You can go into these funny rhythms that can cause your heart to just stop. If you're in an ambulance and your heart stops, they'll just shock you or they give you medicine to get it back. So you're getting, the treatment that you need. If you're in the car with a friend, oh, well, what are you going to do?
Do you think the EMTs do the clot busting drugs?
I
Probably not.
don't think so, but they call ahead. What they do is they call ahead to the ER and they say, this guy's got this going on his EKG. These are his symptoms. And the whole team will be lined up when you come into the ER. They'll be ready with the clot busting drugs. They'll be ready to take you to the cath lab. So this is the fourth little comment down there. You're likelier to get faster treatment at the hospital if you arrive by ambulance, because they're going to call ahead and everybody knows you're coming and they're lined up with this kind of thing. And the most important reason is time is muscle.
Yeah.
The longer that muscle is not getting blood and oxygen, the more damage that's being done. So really, after 2 hours, they say that your heart, depending on what the blockage is like, but you've got damage to that heart muscle. So time is huge. People delay in calling 911. Most of the heart muscle damage occurs within the first 90 minutes after onset of symptoms. Why do we delay calling 911? Why do we delay? Has anybody ever delayed? We don't want it to be. We don't want that to be. No. If we don't call 911, maybe it's not happening. But you said expensive? Yeah. Right.
Was one in Roseville where they delivered the baby in the parking lot. And because they didn't quite make it to the emergency room, they got charged $3,500 for the emergency call because they had to come out into the parking lot to deliver the baby.
Oh my gosh. So I know you can't hear at home, but we're just talking about how expensive
So people
calling an ambulance can be.
So people hear those horror stories.
Yeah, and you hear horror stories about it. Yes, that's true. Right. Exactly. So we want to wait for the pain. One of the reasons that we wait is we're hoping the pain's going to disappear and we're just imagining this, right? We don't think it's serious because it's just a dull pain. It's like I talked about. Even after hearing this lecture, you might leave here and have pain and think, well, it's not like an elephant standing on my chest. But I hope you know it's not always an elephant standing on your chest. It could just be a little pain in your throat, or it could be a dull pain. So another reason is you don't want to get to the ER and have it be that you ate some spicy food and then you think that everybody's going to be talking about you, calling you a hypochondriac. Nobody is going to be doing that. They're going to be glad you came in and got checked out. You don't want to disturb the hospital because there's a lot of sick people. You don't want to, you don't want to, get in the way of people who are really sick, because certainly this is not anything probably to worry about. Or your family, right? And you want to talk to and sometimes people want to talk to a relative first, so they can't get a hold of their wife. They can't get a hold of their children. And so they just keep waiting to get a hold of somebody that they can talk to. Very common. So I have some scenarios here of real people. They did some studies, of course, on how people feel about it. So this is a quote from someone who said, "I was at work when I first had a symptom, and I found an area to hide in until I felt better. I knew," because they didn't want to bother anybody, and they thought they were being a hypochondriac, all the reasons. "I knew something was very wrong, but I never had a sense of doom." So this person had in their head that when you have a heart attack, you have an impending sense of doom, which sometimes you do, but not always. So I never had a sense of doom. I had that I'm indestructible thought.
So why people are like, that's a work.
That's right. That's right. They're around people nobody even knows, because if they're not hiding under their desks, they're hiding in the bathroom, or, hiding in the lunchroom. When I had my heart attack, I didn't think it was chest pain because so many of the guidelines say central chest pain, like right in the chest. My pain was up near my neck and my esophagus, and it kept coming and going. It was very confusing. Even arm pain confused me because I imagined a sharp pain on the outside of the arm, and what I was experiencing was a sense of pressure from the armpit to the elbow. Cheers, Linda. Although I have to admit, I didn't want it to be cardiac related, right? I had pain in my neck and shoulder blades. Checking Google, so we always check Google, right? Checking Google, I was convinced that I had lung cancer. So, and I also thought my indigestion was just too much spicy food. Thank God I did not have a heart attack, but my widowmaker artery was 89% blocked, so I didn't say this, but I showed you the left anterior descending and the right coronary artery. But before you get to those, there's a left main artery that the left anterior descending and the right coronary artery, and the circumflex come off of. And if that gets blocked, it's called the widowmaker, because anything below that is not getting blood, which means the whole heart is not getting blood.
Mm.
So the most important thing that you can do in this situation, and in any situation having to do with your health, really, is to have your symptoms mean something. So in order to do that, you have to, in some way, and I think the best way is with your healthcare provider, make a connection between your symptoms and the cause. Otherwise, you're just running around with your head stuck in the sand, right? So if you're having any symptom now, you want to try to work and figure out what that's related to. And don't just say, "Oh, it's because I'm getting older," right? There's a reason. Even if it's because we're getting older, there's a reason that we're having some sort of symptom. There's something going on. So the most important thing is to keep you healthy is to make the connections between what's going on and what the cause is. Any questions? Everybody's scared now.
Yeah.
Anybody having chest pain from that lecture?
It is man.
So can we go back to the UTI,
Yeah,
which is a urinary tract infection?
Hmm.
'Cause sometimes there's symptoms related to those that you're dizzy, you're out of it, you're mentally
Yeah.
fog. Like Rose had a super interesting episode with, we thought she was losing it because she was just running into things at home and not mentally together. It turns out she had a UTI, and as soon as she got put on some antibiotics, she was better.
yeah, that brings up a good point. Anybody 65 or older do not handle urinary tract infections the way we used to. And they can typically do cause confusion and weakness, and it's just this low level, and you don't always get burning, you might get other symptoms like frequency or having difficulty urinating, but it can be very subtle. And if you have diabetes, you're not going to feel some of the nerves just don't work as well, so you don't feel some of the typical pain. And it's very common for people at 65 or older to have UTI that's causing problems for them. And I had a patient that just passed out in her driveway getting out of the car, and it was just a UTI. So
I just, my cousin just got out of the hospital from a very bad UTI, but they said the symptoms in a man can be different than a woman. He didn't have pain, he had fever,
Yeah,
but he didn't have the symptoms like a woman does.
right. I mean, the whole area down there in women is lots of nerves and very sensitive, and more urine can get in more places. And so it's more likely for a woman to have, pain with urination because there's just so much space there and so many nerves. So I don't really know other symptom differences. It's usually frequency. I would think men would still have frequency because you're going more frequently because your bladder's kind of spasming from the infection. So I think men would still have infection. I'm not an expert on urinary stuff.
Sharon,
Yes.
you mentioned that in Mary's case, you determined that it
I
was a
didn't
B.
determine. I did not.
Oh, okay. So she went and had some kind of blood work that indicated that.
You went to see her primary care doctor, and I will say that she advocated for herself.
Yeah.
She reminded the doctor that she had had B12 was low in the past, and that's why they tested for it.
Uh-huh. Right, okay. And then secondly, I've just been learning about aortic valve stenosis,
Uh-huh.
and it's either it can either be moderate or severe. It seems like there's only two levels or
Well, I
something.
think it's been a while since I looked at the numbers, but I think there's a number that they look at. So with aortic stenosis, your ventricle is getting larger because stenosis means that the valve is just not, it's not leaky, but it's stiff. And so when the heart beats, it has to work really hard to press out the blood against this stiff valve. And so then the heart starts to enlarge. And so if they know that you have aortic stenosis, they're going to follow you with echocardiograms to measure how enlarged your heart is starting to get. And there's a certain point, and I just remember it's 4 millimeters or something like that, where if it gets to that point, then they do treatment on the aortic valve. So they follow the numbers that they get on the echocardiogram, and from there they determine, and there's a certain point where they decide that you need to have something done to your aortic valve because it's affecting your heart.
And now that's can be done both open heart, and in some cases they do it through the less invasive.
Yes, there's all different treatments they can do for valves now, and it just depends on which valve it is, what your valve looks like, what your heart is like, your age, all those things.
And testing for something called BNP.
Yeah.
Um,
B natriuretic peptide.
uh-huh. And
Yeah.
when do they do that, and what is that?
BNP is a chemical that's released from your heart muscle, and typically it's released when you're having heart failure and your heart gets congested, that number will go up. So it's a number, if you have heart failure, they measure it, all the time because they can tell if you need more diuretic.
Mhm.
And so typically, you have a baseline BNP number, and that'll be in your chart and everybody will know what it is. And so if you get a BNP, say you're having shortness of breath or you have leg swelling, they'll test that. And if the number's gone up, it's an indication that you're having an exacerbation or a worsening of your heart failure. And they'll treat you with some more diuretic for a period of time.
So they first need, at some point, if you have heart history or whatever, they get a baseline on that.
Yes, they do. Yeah.
To begin with.
It's good to know because everybody's like, probably I don't have heart failure. So likely if they did my BNP, it would be, really low, like, 20 or something. But if you have heart failure, your BNP baseline is going to be a little higher to begin with. And everybody's is different. So important to know what your baseline is and then what an exacerbation or an elevation would look like.
And I saw two scores, two different kinds of scores, one BNP and one something BNP, and one was
Oh,
around the tens or the something, and the other one was around the hundreds. So,
it's just two
yeah.
different ways of measuring it, and different hospitals measure it different ways. So sometimes, and one is in the thousands and the other is in the hundreds.
Yeah.
Yeah, so you can't compare the two. They have to be measured separately on their own, and you have to know what the baseline would be for each of them for you.
Yeah.
Different hospitals measure
Which they
different ones.
used. Yeah.
That's
Yeah.
right. Yeah.
Thank you. Thank you. This has really been, I've got 4 pages of notes.
Oh,
And maybe Linda can, I don't know if you will let her have your slides, but yeah,
yes. Yeah, she always sends those out, I think, don't you?
great.
Yes. Yeah, Linda sends those out.
Only takes
Thanks so much.
to pop up on the YouTube feed.
Yeah, a day or two. Any other comments or experiences you've had with confusing symptoms that eventually got sorted out? Any, do you guys, can you guys relate to the reasons you might not call 911? I can totally relate to those reasons.
Oh, Randy did.
Yeah, but keep in your mind, time is muscle and you only have one heart, so let your executive part of your brain, the frontal lobe, take over and just say, you are calling 911. I'm not listening to the rest of you people that are talking in my brain.
Thank you, Sharon, that's great.
Thank you, everybody, for coming. Thank you for all the good questions. Thank you.